Assalamu alaikum guys. So today the journal surgeon is here and we are discussing about the retroperitoneal tumor today. Uh, basically, like we are usually discussing about the history taking. So we will discuss about how to take history from a patient who came with the retroperitoneal mass. So let's start. Okay. First of all, starts with the introduction and consent from patient, then brief biodata of patient, and then come to the presenting complaint. Okay, so the patient usually presents with the lump in abdomen, pain, basically lower back pain, edema, pedal edema or facial edema, urinary complaints like increased frequency, urgency, nocturia, difficulty in micturition, and fever. So let's talk about the lump first. For how long the patient is having this lump? When did the patient notice lump and what he or she was doing at the time? Ask about the another lump the patient is having, another lump in the body. Then ask about the change in size of the lump, whether it's increasing with time or remain same or decreasing in size with the passage of time. And ask about this change in the size, if it's occurs sudden or gradual. It's very important. Ask about the consistency of the lump, either it's mobile or fixed lump. Either it's irreducible or a reducible lump. Ask the patient to locate site of lump. With the help of the finger. Any skin changes over the lump. What does it cause to the patient, like either it's causing pain or patient is having difficulty in walking, so ask about this. Ask about the any previous biopsy, any ultrasound. So these are the questions for the lung. Then continue with the second one. Let's talk about pain. So the mnemonic is Socrates. Okay. Ask about the site of pain, onset of pain, character of pain, radiation, relieving, aggravating factors, timing, and first of all, events related with the pain. And if yes, so for how long the patient is having this pain. We already mentioned the site of the pain, Then ask about the progression of pain, either it's increasing in the time or decreasing. Shifting of the pain and the frequency of the pain, and how does it relieve. And you have to ask about the medications history. This is very important. Then continue further and ask about the third symptom, which is edema. The edema occurs because of the large marks. There is compression of the inferior vena cava, and it will lead to the pedal edema and venous dilatation in legs, over abdomen, and in testes. And also ask about the ascites, which is very important. The fourth symptom would be urinary complaints. Ask about the obstruction, increase frequency, nocturia, facial edema, dribbling, and fifth complaint would be fever. So the question regarding with the fever, for how long the patient is running fever, intensity of the fever, frequency of fever, either it's continuous or intermittent, with rigors and chills and night sweats and relieving factors. So these are very important.